Hi, I'm Becca. I'm trying to learn medicine. Today, Alkali and Alkalosis. And after we've done that, we're going to do leg injury prevention training. And if you're participating in the leg injury prevention training, then it's better the youngest. And we're talking about a bit about internal anatomy, digestion, I think, a bit, and the blood system. And this is no medical advice. We're just reading about it. This is part 2. Alkali. Alkali is a substance that neutralizes an acid. Alkalis in the body help to ensure that the blood and the digestive juices from the liver and pancreas are kept slightly alkaline. The main body alkali is sodium bicarbonate, formed from sodium in the diet and carbon dioxide. Okay, we want to explain now alkali in here what is important for medicine. Alkali is in the human body to neutralize the acids, and it makes sure that the blood and the digestive fluids from liver and pancreas are slightly alkaline. And the main body, alkali, maybe we're going to use the exact same words, the main body of alkali is sodium bicarbonate, and that is formed from the sodium in the diet and carbon dioxide. Okay, I'm able to say that Alkali are used in the human body to keep the digestive fluids and the blood slightly alkaline. Alkali makes things less acid. A substance that neutralizes an acid. Alkali neutralizes acid. And the digestive fluids of pancreas and liver, and also the blood system, alkaline. Alkali neutralizes acid a bit in the human body. And the main body of alkali is sodium bicarbonate, and the body gets it through sodium of the diet and out of carbon dioxide. That's all. I have a second camera, which I'm going to start now. Alkali are used in the human body to keep the digestive fluids, which are made by the pancreas and the liver, and also the blood, a little alkaline. Alkali neutralizes acid a bit. And the main body of alkali is sodium bicarbonate, and the human body gets it through the diet. It gets the sodium out of carbon dioxide. That is according to Keith Hodgkin's Family Medical Advisor, page 69, but this is no medical advice. I said what I wanted to say, not the most this way, but I said it. I'm going to stop the camera and start with the note again. Because we're having a second part here. Alkalosis. Alkalosis. A disorder caused by a considerable rise of alkali in the blood, so rise of alkali, more alkali in the blood and in other body fluids. It can be caused by prolonged vomiting, which passes hydrochloric acid out of the system. So we're just going to say it before really understanding it. Which passes hydrochloric acid out of the system. Oh, but I understand it. It passes with the acid out, and therefore more alkali is there. And it makes sense that vomiting brings the acid out of the stomach, and the acid juices produced by the liver and pancreas, which are in the stomach, and if you vomit, they come out, and you lose all the acids, and now there's too much alkali. Okay, it passes the hydrochloric acid out of the system, vomiting. It can also happen for taking too much sodium bicarbonate to treat indigestion. So it means that there are people taking sodium bicarbonate to treat indigestion. What exactly is not a problem of indigestion? Whatever, some problem of indigestion. It can happen through sodium bicarbonate medicamentation to treat indigestion. Sodium bicarbonate is one of the main part of carbon dioxide to make alkali in the human body, to make sodium bicarbonate, to make the alkali which is used in the human body to make things like as in alkalosis. There's not too much alkali, so people taking sodium bicarbonate, one of the main substances, to build it, or by abnormally deep breathing that results in excessive loss of carbon dioxide. Why? if they now losing carbon dioxide, when we have not the carbon dioxide to create the alkali, well, why do we have not too much alkali? Maybe it's too concentrated. That would be interesting. It's the same amount or even less or whatever, but it's more. Imagine the alkali gets stronger if there's less carbon dioxide in it, but more sodium bicarbonate. More sodium. The sodium and the sodium bicarbonate is the thing together. Sodium bicarbonate is sodium and carbon dioxide. Sodium bicarbonate. I don't get it completely, but that's the word. Sodium bicarbonate. Sodium and carbon dioxide. Okay, so let's not go that much into details. I'm not going to explain all the details. Alkalosis, where the human body has too much alkali in it. A disorder caused by considerable rise of alkali in the blood and in other body fluids. Blood and body fluids, we're going to take it down to body. If you would say it, it would be blood and other body fluids. And the causes for which can happen is prolonged vomiting. Do we explain it? Let's explain it. No, not maybe this. Which passes hydrochloric acid out of the system. Because when the hydrochloric system it passes out of the body, and why is when there too much alkali there? It would be just in a relationship to the now less hydrochloric acid in the human body. It will not be automatically more alkali. Considerable rise of alkali, because the introduction sentence says it has to rise, but just because the hydrochloric acid goes down does not mean automatically that the alkali goes up. But they say it as if it would happen, and that is interesting. Because that is a big difference. If just one drops because people vomit out, and now there's a difference, and that would be a problem, too much alkali, or if it actually rises if hydrochloric acid is vomited out. So we're not going to say, let's keep our explanation short. We're going to take the one here. Because when hydrochloric acid is passed out, then it can happen for people taking sodium carbonate to treat indigestion. Sodium carbonate is one of a part of carbon dioxide of the main bodies for the human body to make the alkali, which is normally used to neutralize the acids in the blood and the digestive fluids formed through the liver and pancreas. And it can also happen through abnormally deep breathing, because when excessively carbon dioxide is lost. Symptoms: tingling skin, muscle weakness and cramp. Tingling skin, muscle weakness and cramp. Skin, muscle weakness and cramp. Muscle weakness and cramp. It's interesting combination. And vomiting is because the transfusion of saline solution may be needed. We're not going to say it. Maybe it is an interesting information, but I don't think we're going to say it. Because we have no explanation why that should happen, and we don't want to even sound like giving them medical advice. Alkalosis. Alkalosis is if the human body has too much alkali. I think we can shorten it down to that. That's okay, I think. Considerable rise if there's too much alkali. And it can happen through vomiting, because when hydrochloric acid is passed out. It can happen through taking sodium bicarbonate tablets to treat indigestion. Sodium bicarbonate is one of the two parts, a part of carbon dioxide, to form. But it doesn't make sense with the third thing, with excessive breathing, which can excessively pass carbon dioxide out. With the abnormally deep breathing passes out excessive loss of carbon dioxide. Symptoms: muscle weakness, cramp, and tingling of skin. Let's try it. I want to stop the camera. How do we say the thing with the saline solution? Let's look at it. When vomiting is because a transfusion of a saline solution may be needed. That is sometimes treated with a saline solution. And we're going to say alkalosis. Alkalosis is a medical condition in which the human body has too much alkali. And it can happen through three things. It can happen through vomiting, because when hydrochloric acid is passed out. And it can happen through taking sodium bicarbonate medication to treat indigestion. Sodium bicarbonate is a part of carbon dioxide, one of the main parts to make for the human body alkali, and they are used in the human body to neutralize acids, the acid in the blood and of the digestive fluids produced by the liver and pancreas. And then the third cause is, for example, that people are breathing abnormally deep and when excessive carbon dioxide is passed out. And the symptoms are muscle weakness, tingling of the skin, and cramps. And that is according to Keith Hodgkin's Family Medical Advisor, page 69, but this is no medical advice. I'm going to stop the camera. And it was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now leg injury prevention training. If you stay and participate in the leg injury prevention training, there's at your own risk. One leg up now. Stand on one leg and swing the other one with the next foot to the side and in front. And the other foot to the side. And now bring one foot in front and back. And the other leg in front and back. And now bring one foot up, pine pulcro, without to the side, again in, out and down, other leg up, out to the side, in the middle, out and down. And now one leg up, arms out, and turn with the upper part of the body with the arms out to one side. And go to the other side. The middle, and now arms over and also leg over. And change. Turn the middle and down. Other leg up, and go with the hands to one side. Over to the other side. And no, leg over to one side. And off. And a little and down. And now one leg up and press with the knee up and to the side. And the other knee up and press up to the side. And now next exercise, I think it's called the prospector. This exercise can go a bit under the knee. Stand good with one knee, turn over to the leg, go down to the knee, over to the other side, come up again. Then up around, stand good, turn over to the standing leg, go a bit down, over to the other side, come up again. With the other leg. Good standing, turn over to the leg, go down, go to the other side, and come up again. And another round. Stand good. Turn over to the leg. Go down. Turn to the other side. Come up again. Now the clock can go again onto the knee. Go in front, go a bit down to the knees while you do it. And always in 90 minutes intervals. To the clock. And there. Like. And we also do 10:30 at 9. And now with the other leg. In front. And there. And back to 6, and to 4:30, and to 3, and also there to 1:30, and 3. Now, one hand on tummy, one on lower leg, and bring one leg up in a straight line. Foot is flexed. If the leg cramps, then bring the leg up and point the foot down. Try to bring the leg higher. Straight leg, flex foot. Try to bring the leg higher. Control with the hands that you don't fall back. And bring the leg up and point the foot down. And the other leg. One hand on tummy, one on lower back, and bring the leg up. Flex foot, try to bring the leg higher. And bring it up. And now the stem, up and down. Down. Our leg up and down. Down, baby pad, heel onto the ground, and lift the heel off the ground, place it again on the ground. And the other leg, place it on the ground, lift it off the ground, off the ground. And the horse. Knee in and out, again in and out. And the other leg, knee in and out. And now the camel you can do instead of the horse. So knee in and out, but this time the whole body comes with it down. And with the other leg, knee in, out. And legs wide apart, breathing out on. Breathe out. Breathe in, close the legs. And breathing in out. That was leg injury prevention training. I thank you very much, and until next time.